Good afternoon. I'm David Sweat, Deputy Director, Shelby County Health Department, and welcome to the April 15th, 2021 City of Memphis, Shelby County Joint COVID Task Force press briefing. Today, starting with the numbers, we'll start in Crittenden County, Arkansas. 5,558 cases have been reported so far from Crittenden County. In Fayette County, we've had 4,876 cases reported so far. Up in Tipton County, 7,193 cases have been reported in the epidemic so far. And in DeSoto County, Mississippi, 20,901 cases have been reported. Today for Shelby County, we're at 93,246 reported cases, which represents or includes an increase of 262 new cases yesterday. We've also had 1,593 fatal cases in Shelby County, and that's an increase of 7 reported deaths in the last 24 hours. From the vaccine campaign data, we're at 283,929 people have been vaccinated so far, and that includes 114,401 people who have gotten the first shot of a 2-dose series, or 169,528 people who have had 2 doses of a 2-dose series or had received Johnson & Johnson vaccine and so are fully vaccinated. And if we could pull up some slides about the vaccine campaign data just to show you where we are. We have reached about 40.6% of our goal, and that means 30% of the population is vaccinated right now, and a little over 40% of the vaccine campaign target goal has been reached, our goal of 700,000 people vaccinated. Next slide, please. And when we look at who has been vaccinated, we have over 68% of the people 75 years of age and older have been vaccinated. Approaching 68% also of our people 65 to 74 years of age have been vaccinated. But as we look down the age spectrum, I wanted to particularly call out and recognize and thank the over 19,000 people in the youngest age group, the 16 to 24-year-olds who have come out and received a vaccination so far. Thank you for folks, even at the youngest age ranges, for coming out and getting a shot. Almost 19,000 or a little over 19,000 of you have, and we want to commend you for that and thank you for doing your part as well. We want to see everyone across the age spectrum coming out to get their vaccination. Next slide, please. And what you see here is a map of Shelby County by zip code showing where vaccine uptake has been most populous or most dense, and all of those areas for the most part are on the eastern side of the county. So that's the part of the county that is most heavily penetrated by vaccine. We also see in the medical district that we've had a strong uptake of vaccine. Of course, that's associated with our hospitals. But the eastern side of the county is where we need more folks to really come out and take part in take advantage of the opportunity to get their vaccinations. And when we look at the next slide, you can also see why this is important. This is a density slide looking at the number of people with variant cases. In other words, the B117 or some of the other variants of public health importance. They are concentrated more heavily on the western side of the county. And the areas on the eastern side of the county where there's been greater uptake of vaccine have fewer cases that are with the variants that have been reported. The vaccine protects against the variants, or at least the B117 variant out of the United Kingdom, which is now the dominant virus in the community. And we can tell, just looking at the difference between where vaccine has been most heavily taken advantage of, that those areas are having a better experience right now in the epidemic. Next slide, please. So this is an epidemic curve showing the spread or increase in variant cases, and the salmon-colored cases, the bars with the B117, you can see that those have really taken off in March and April. And at this point, those viruses are our dominant viruses. They're the ones that most people have if you have currently active COVID disease. Those variant cases are 30% more deadly, and they're 50% more transmissible. People infected with those B117 strains have a much higher viral load in their body, and that makes them more infectious to be around. So with that, I'm going to turn it over to Chief Gina Sweat from Memphis Fire to give us an update on where we are with the vaccine campaign.
Thank you, David, for that dive into the data. I think it's really clear. One of the things we pride ourselves on in the fire department and the city of Memphis is making data-driven decisions. So it doesn't take a genius to look at those graphs and see the areas with the highest uptake of vaccine have the lowest number of cases of the variant COVID-19. So I encourage everyone, strongly encourage everyone, if you're on the fence about getting the vaccine, let's go ahead and do this. Get your vaccine. We have, the city of Memphis, our vaccination effort, we have the multiple pods across the city. We have the mass vaccine site at our Pipkin building at that community. The address is 940 Early Maxwell, and there is no excuse to not get the vaccine if you want it. If you want a shot, you can get the shot. As David said, we've had a lot of strong work in the vaccination process. Just at our mass vaccine sites, we've administered over 33,000 doses in the last 7 days. But what we're really also proud of, so if this is something that's keeping you from coming out, our wait time, the average wait time is 11 minutes. So I think you wait in line for your lunch longer than 11 minutes. And so I think it's well worth it to come out, go through the short wait time to get into the building, get your vaccine so that we can all get back to normal. Speaking of that, as if the data wasn't good enough, we're going to have a few events that we're going to be doing this weekend to just try to encourage people to come on out and let's have a lot of fun this weekend and get everyone vaccinated. Yesterday, we started our first WOW Wednesday, Wide Open Wednesday. No appointments needed, no ID, just show up and get your vaccine. It was very successful yesterday, so we decided to extend that to WOW Wide Open all week. So for the rest of the week, 7 a.m. to 7 p.m. through Sunday, no appointment needed, no ID, just come out and get your shot. If you have an appointment that you had already made, we will honor those appointments and make sure that you get in and out of there as fast as possible. So as if that wasn't enough, we have collaborated with partners, and on Friday and Saturday, each day, the first 2,500 people who come to our Pipkin site at 940 Early Maxwell will get a $20 Kroger or Walmart gift card. You heard it here, $20 Kroger or Walmart gift card for the first 2,500 people that show up on Friday and Saturday at our Pipkin Community Vaccination Center. Can't get any better than that, right? Also, getting back to normal, the U of M will be having their spring football game, Friday night stripes game on Friday night. And we'll be having our community vaccination unit, the Memphis Fire Department community vaccination unit will be there on site to administer vaccine to those going to the game who would like to get it. For the first 500 people who get the vaccine at the football game, you'll be given a $10 voucher towards concessions to be used at the game. So come on out to the Pipkin site this weekend. There'll be a lot of other great swag giveaways on Saturday, some Grizzly swag, some McDonald's swag. Just going to try to have a good time out there while we're also making sure we keep our community safe and get everyone vaccinated so we can get back to normal. So with that, I will bring up Dr. Randolph, who's going to cover a little bit of information about the new health directive that went out today.
Thank you, Director Sweat and Mr. Sweat. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the Health Officer, Shelby County Health Department. I just want to give an update and have a few words pertaining to the health directive that was issued yesterday, April 14th, that will become effective on April 17th at midnight. Main thing I want to just highlight some of the changes. Of course, we're strongly emphasizing and encouraging those who are age 16 and older to get vaccinated with the Pfizer vaccine. And for those who are 18 and older, can receive the Moderna. And we really strongly encourage everyone to do so that we can do more. We know that there are benefits from being vaccinated. You can be around others who have also been fully vaccinated and not have to wear your mask or maintain social distancing within your household or among people who you know. If you're vaccinated, you don't have to go into quarantine if you're exposed to someone, if you're not having symptoms. If you're vaccinated, you can also travel without being quarantined. So there are some benefits. You can spend time with your loved ones who have also been vaccinated. The other thing pointed out in the health directive, landlords, as I mentioned on Tuesday, will be required to provide their tenants information about resources that are available before they evicted, so that these individuals, particularly if they have been placed in isolation or quarantine, are not just put out on the streets, but that the health department are aware so we can make the appropriate plans and the appropriate resources available for those individuals who need to be in isolation or quarantine. We are opening up buffets, and we're encouraging all establishments who have buffets to make sure that they have signage and have available stations where customers can sanitize their hands prior to going to the buffet to serve themselves. I want to point out that also customers must wear their mask while going to the buffet. We're allowed that the mask is removed while sitting at the table and actively eating and dining, but when you get up and move around while going to the, such as going to the buffet, you ought to have on your mask, as well as if you're just sitting as complete your meal and you're just talking and fellowshipping, you should wear your mask. We also are allowing indoor dancing as well as outdoor dancing, but we also requiring that you still maintain your social distancing, and of course wearing your mask as well. But we feel that it is permissible to do so. And the other thing that I want to emphasize to establishments, event organizers, if you're planning an event, use the health directive as your guide for implementing the appropriate preventive measures to be able to operate safely. And if you do that, you should develop a plan, have it available if called upon, but you do not have to submit it to us for prior approval unless it involves more than 500 people. And that would allow people to operate, function. We're getting a lot of requests for review of plans that oftentimes involve 50 to 100 people. And we believe that the health directive provides adequate guidance if people adhere to it. And we're asking and requiring that you do. The other thing is that you remember the last time I spoke earlier this week, we had mentioned the fact that we were exploring, examining the data to see what changes we would make with the relaxing of some of the restrictions. And we're still continuing to do that and to monitor. The news about our latest data certainly caused us to pause and make sure that we're looking closely at what things that can be relaxed and what things that we must continue to have in place so that we can remain healthy and safe, and more to come on that. I will now stop and entertain any questions that you may have.
Michaela Watts, Commercial Appeal. Michaela, I think you're self-muted.
Hey, sorry about that. First time on a Zoom press conference. Just kidding. I wanted to check in with a couple of updates. And the first one I wanted to ask about are P1 cases, the variant P1. Have we seen any additional cases beyond the initial clusters identified?
I'll let Mr. Sweat answer that.
Thank you, Michaela, for the question. We have, over the past couple of days, had another P1 reported to us, and we're investigating that and isolating that individual and quarantining those contacts. Still a small number of P1s, as less than 10 that have been identified in the county total with the P1 variant, but we did get another one, yes.
Okay, great. And my second question is checking in on our hospital patients who are ill with COVID-19. Are we seeing the age of those patients trend in a younger direction?
I'm not sure the age distribution piece of that. I'd have to ask somebody to go look at that data and compare it to prior data, so I don't want to just make an off-the-cuff comment on that. But what I will tell you is that we are seeing indicators go up in several key categories. One, of course, obviously you saw we had an increase of 262 cases yesterday. We also had an increase in our test positivity rate up to 5.8% as of yesterday on our 7-day rolling average. And then our reproductive rate of the virus, as calculated yesterday, was 1.1. So that's the biggest jump in RT or reproductive rate that we've seen in many months. So those are all indicators on going up. Now, the hospitalizations, both the ICU and the acute care bed hospitalizations, are still stably more or less flat, but those are lagging indicators. They tend to fall behind increases in other areas by about a week to 10 days. So we'll be monitoring over the next 7 days our case counts, our reproductive rate. We'll be also looking at the positivity rate on tests, but we'll also be watching those hospital indicators of all kinds to see, do they start to go up? Because then that'll be, another week after the increase that we're seeing right now.
Brad Broders, Local 24.
Thanks. Good afternoon, everyone. My first question is to Dr. Randolph. You had touched on it a little bit a second ago, Dr. Randolph, but could you speak a little more on why you felt it was okay to no longer have permits for those events under 500 people, and why you believed requiring landlords to provide more resources was needed in this latest directive?
To answer your first question, we feel that the health directive is very clear in terms of what's required of everyone who's planning to have an event, a business who's planning to reopen, etc. And to be frank and honest, it's just the massive number of requests that we were receiving were exceeded, our staff capability to do them in a timely fashion, when in fact that most of the plans that were permitted to us reflected the health directive. I mean, people were very good about going to the website, looking at the health directive, and pretty much making sure that their plans reflect that. And so we feel that people would do. We have our COVID response unit who is actually going out and providing technical assistance and education to businesses and to events, and particularly when we get complaints, if we need to do some enforcement. So we feel that our time, energy, and effort would be better spent on educating people and providing the technical assistance and focusing on the larger events than the wedding that's taking place with 50 people in the backyard. And your
Thanks.
second
And my
question?
follow-up-
Yeah, follow up.
Yes, and my follow-up to Director Sweat, what does this say, the upcoming events this weekend, expanding? I guess, what does that say about, on one end, the ongoing demand challenges, but also what does it say about this, you all just continuing to evolve and try new things to get people participating?
All right, great question, Brad. As you know, we've built a system to be able to deliver 50 to 60,000 doses of vaccine a week as the inventory of vaccine increased in our community. So we have the capability to do that. We're still, at our community pods, we're delivered 33,000 last week, but I believe it was more than 41, almost 42,000 throughout the community through other agencies such as pharmacies and our other partners that are also administering vaccine. So I think what we're starting to see is some normalization of the process. We don't want to be in the mass vaccination pod business forever. We want it to be normalized like other vaccine efforts that, where they are done in doctors' offices, clinics, pharmacies, and things like that. So I think we're starting to see some of that. And, as the city of Memphis, we're not going to quit. We're going to remove every barrier. We're going to remove all obstacles. That we're going to remove. There's no reason, no excuses. Anything that we see, any adjustment we can make that makes it easier for the citizens to come in and get vaccinated, that's what we're going to continue to do. Yesterday we've been hearing loud and clear that a lot of people don't like being stuck to an appointment time. So we tried it out yesterday. It was successful in getting our numbers up yesterday. So we're going to try it for the rest of the week, and we'll continue to do that. We listen. We're listening to the public. We hear you, and we're going to continue to do what we're doing and pivot as we need to give everyone an opportunity at our mass vaccine sites, and also as we reach out into the community with our community vaccination unit and those things, to reach out to the community, meet them where they need us to meet them at.
Stacy Jacobson, WREG.
Hello, can you hear me?
Yes.
Okay, thank you. So with us having such a big increase in cases today, I believe it's the highest since mid-February, what do you all attribute to such an increase in cases coming today?
I'll turn that over to David.
Thank you for the question, and Dr. Randolph and I were texting about this last night, and honestly, it could be one of two things. It could be a temporary increase that's driven primarily by spring break travel, Easter holiday gatherings, and the arrival or the dominance of the B117 variant in our community. That is a temporary increase. So that could be one possible interpretation. We won't know whether it's temporary or not, though, until we see a few more days worth of data and see if the numbers return back to a lower level. The other possibility is that this is representing a beginning of an increase or continuation of an increase that started last week that will be sustained. And in that event, it would mean that we're entering a fourth wave. And if that's what happens, then we're going to have to adjust accordingly. So the real question that we have to watch over the next 7 days is this a trend where we continue to see higher levels of cases like this? Or is it a blip and we go back down to a lower level of average number of cases per day? Could go either way right now. We don't know which it will be. Dr. Randolph, do you have any further? No? All right. So next question, or do you have a follow-up?
Yeah, so I'm wondering if what the thinking is, given that we were at an increase already and now we're seeing such a big increase today, and this could be a fourth wave, what kind of signal relaxing the health directive yesterday sends, and why that, what's the thinking behind that timing given the setting that you just laid out?
Right. Well, remember that the things that were tweaked in the health directive that's going into effect on April 17th are really relatively minor adjustments from the prior health directive. I mean, really the biggest one is that restaurants that have buffets are going to be allowed to let customers self-serve at the buffet again. We know this is a respiratory virus, it's not a foodborne virus, and they still have to wear a mask as they go to the buffet, and we ask them to sanitize their hands before going through the buffet. We believe that there's little, if any, impact on respiratory transmission from allowing a restaurant buffet to reopen. So some of those things are just minor tweaks. We haven't made a major, substantive relaxing of anything in this health directive that would pose an increased risk in the community of driving spread higher. But we are going to continue monitoring the data, and in the next health directive, we'll make a decision whether it's going to be issued in 2 weeks or in 4 weeks. So we issue health directives about every 2 to 4 weeks, and over the next 7 to 14 days, we'll be watching the data. If it's warranted, we'll have another health directive in a couple of weeks. If things are stable, we'll stay the course for a month, and we'll just continue monitoring the data.
Kelly Roberts, WMC.
Hi there. I'll keep on topic when it comes to a possible surge or fourth wave, if that is on the horizon. The numbers that we saw over the last 24 hours, for example, if something like 260 some cases, a day is our kind of rolling average over a week, is that considered, a surge that you would kind of take a pause when it comes to reevaluating all those mandates? Or what ballpark kind of numbers would you have to see, that would cause some real concern and the likelihood of a fourth wave?
Well, I mean, if we go back into having 200 plus cases a day, that would be a pretty dramatic increase from where we were a couple of weeks ago. I mean, a couple of weeks ago, we were averaging about 100 a day. Some days we were having maybe 50 or 40 cases reported. But throughout the epidemic, we have seen oscillations, and we've seen temporary, a particularly bad day, and then it sort of subsides, and then we've seen more sustained increases. So we'll be just watching the data and trending it to see, is it a minor increase, like, you get a big wave at the beach for, one wave, and then it's back to real small waves? Or is it like, hey, we got a rising tide, a lot of waves coming in and higher? That's something that we can only tell by monitoring the data day to day. But 2 weeks ago, we were averaging about 100 cases a day. Last week, it was 130. So there was a slight increase. But obviously, 262 is a big jump in one day. We haven't seen that in quite a while.
And my second question, real quick, is about the Pipkin vaccination site. Wondering your thoughts on just drive-through vaccination sites in general, knowing that there's been a lot of work to get more people to come out. Is there an idea that maybe drive-through sites are kind of plateauing? Any discussion on moving sites to outside the drive-through realm to maybe businesses or employers?
Yes, thanks for that question. We're actually exploring all of those options. A lot of employers are working with their healthcare providers to be able to deliver to their employees at a different location. But the Pipkin site also has the capacity and the ability to handle walk-ups. Last week I think we discussed partnering with MATA, and MATA Plus would actually bring people into the site, but MATA itself will drop people off at the MATA bus station. They can walk in and get their vaccine inside of the Pipkin building, be monitored there, and then be shuttled back out to the bus stop again. So the Pipkin site, we have the capability right now to handle 56 cars at one time, both inside the building and outside the tent, but we also have an area that can handle up to 15 to 20 walk-ins at a time as well. So we do have people walk in on a daily basis, and we're starting to see that opportunity a little more, so we're expanding that capability inside the building as well.
We are out of time. Are there any closing messages today?
No, I just want to encourage everybody to come out. We've got a lot of events happening at the Pipkin site this weekend, 7 a.m. to 7 p.m., no appointments necessary, no ID needed. Friday and Saturday, $20 gift cards for the first 2,500 people. And come on out and support the Tigers tomorrow night at the Tiger game and get your vaccine there.